Today we report 271 people who have tested positive after sampling 4,019 cases in the last 24 hours. We now stand at 30,636 positive cases in the country, and we have also pushed our cumulative number of tests to 398,585. Among these 266 cases that we are reporting today, all of them are Kenyans, with the exception of 4 who are foreigners. 178 of them are males and 93 are females. The youngest case is a 1-year-old baby and the oldest is 80 years old. The distribution of the cases by counties is as follows. As usual, Nairobi leads with 99 cases, Kiambu with 20, Laikipia with 20, Migori with 18, Uasin gishu 18, Busia 12, Lamu 11, Samburu 11, Turkana 10, Kajiado 9, Makueni 4, Garissa 4, Nakuru 4, Mombasa 3, Machakos 3, Muranga 3, Kisumu 3, Kilifi 3, Taita taveta 3, Tana River 3, Nandi 2, Nyeri 2, Marsabit 2, Kirinyaga 1, Vihiga 1, Embu 1, and Kitui 1. I'm happy to inform you also that 208 patients have recovered from the disease. From this number, 161 have been released from the home-based care program, while the remaining 42 were discharged from various hospitals where they were receiving care. This brings the total number of recoveries to 17,368. And I want to take this opportunity to extend our greatest appreciation to our healthcare workers for this great achievement. On a sad note, 5 patients have succumbed to the disease, bringing our total fatality to 487. We send our sincere condolences to the families and friends of those who have lost their loved ones.
Our regional response is specifically based upon internally displaced people, refugees, as well as the returnees and the urban vulnerable population and pastoralists as well. So we are working very closely with member states, all 7 member states. Our member states are 8. Eritrea is not active now, but we consider Eritrea also a member state. So we are working with all member states, especially on the areas of the member countries are not active in refugee areas and so on and so forth. So far in the region, as you know, the trend is still upside. Ethiopia yesterday witnessed more than 1,000 cases. The second case is in Kenya. Kenya is also yesterday and today is above 200. And at the same time, Sudan 96. Djibouti yesterday it was 3. Somalia 7. Uganda 60. Generally, when we analyze these things, this thing is still a challenge for the region, not only for the region, but also for the world, specifically for us, the region who is suffering by heavy flood and locust invasion. These things makes the region a region of a triple threat region. So that's what IGAD is doing. We are responding with member states on this issue. We are organizing or coordinating the resource mobilization from our partners. So I'm here today to work with the officials of the Ministry of Health, as well as our brothers and sisters here, to work together to identify the area of coordination. So I'm very happy all member states are working very closely in the border areas, in pastoralist areas, as well as in the migrant areas. So this is a very important symbol of coordination in the time of challenges. So we hope that we'll come over with this problem specifically if we coordinate our efforts, this will not be a big challenge. Already this region is passing through a different challenges that we have faced.
Let me take the first opportunity to thank the Executive Secretary for the donations to our refugee camp. The Dadaab refugee camp is the biggest refugee camp in this region. We host very many nationalities. In terms of the infections in the county, 80% of the infections in Garissa County are from the refugee camps, the Dadaab complex. So this help and of PPEs is going to go a long way in the prevention of further infections in our camps. About preparedness, I think you know that our rural health infrastructure is very fragile, is inadequate. But since the pandemic started, we have made great effort to ensure that we prepare for our worst case scenario. And so far we are satisfied with the preparations which have been made and with what is happening in the counties. And we will continue to improve on those efforts. And we think we will be able to counter the spread of this pandemic. Finally, worried to note that the infections, recent infections, have predominantly been among the young people, including even infants. What I suspect has happened is our messaging since this pandemic started was putting a lot of emphasis on the threat of this disease to the elderly and those with underlying conditions. And even when some people die of this disease, we have always tried to attribute to the underlying conditions. I want us from now forward to make our message neutral. I think that previous messaging has led to recklessness on the part of our youth who think that either the disease is not a threat to them, or if they got, then they will not lose their lives because they have no underlying conditions. I think what we need to do now is to make our messaging neutral, that this pandemic is a threat to everybody, regardless of age or underlying conditions, and our youth need to take the precautions. Because the elderly people like me, I think, have taken cover. Since there was a lot of messaging that anybody in that bracket was threatened. But the youth, on the other hand, have been a bit reckless, I think, in their behavior. So let us emphasize for everybody that this disease is a threat to everybody, including infants as young as 8 months old. And we need to be very careful with our lifestyle and follow the protocols.
The specific question targeted at him and his county.
Yeah, commensurate with the number of infections or positive cases in our county, and also on our own projections, I want to confirm that as a county we are ready for this pandemic, especially the isolation facilities. Currently we have 294 isolation beds, including those which are in the refugee camps. We have 108 beds facility which is getting completed this week, and we are going to start another facility for 50 more beds, which will take 3 weeks, I think, which is going to start this week. So I think overall we are happy with our efforts, we are happy with our preparedness, and we think that we are ready to counter this pandemic. Thank you very much.
But we must be very cautious before we start saying that our curve is flattening. We do not think so yet, and we have to take this with a pinch of salt, and let us not believe our curve is flattening. We have realized, of course, the number of tests are also not as many as we were testing 3 weeks ago. The CAS has addressed this. But of course, there are good indicators in terms of reductions in case fatality. Like in Mombasa, I think the case fatality has gone down. But the best indicator is the number of cases that are in hospitals. When this starts going down, and the deaths start going down, then you can probably start seeing, yes, our curve is going down. But by and large, our positivity rate has remained almost the same. So if you take 1,000 samples and 550 remain positive, that rate is to tells you that the positivity rate is still at where it was at 5%. So let us not rejoice at the reducing numbers that are announced every day and say our curves are flattening. It is not yet, and we have to assess it further using other indicators.
Zainab Mohammed, TV47. Number one, what is the current situation of COVID?
This mean, have we reached our peak or is it the beginning of flattening the curve? The status of targeted testing